ZELSUVMI is a prescription gel for treating molluscum contagiosum that can be applied once daily in the comfort of your home. ZELSUVMI should be used exactly as directed. To ensure accurate preparation and effective use, each box of ZELSUVMI includes one blue tube, Tube A, which contains berdazimer gel, the active ingredient in ZELSUVMI. One yellow tube, Tube B, which contains a hydrogel, and a reusable dosing guide designed to mix the gels properly before application. When preparing the daily application of ZELSUVMI, place 2 tubes and the dosing guide on a clean, flat surface. The first time you use ZELSUVMI, pierce and break the seal on Tube A by removing the cap and pushing the pointed end of the cap into the foil seal. Then replace the cap. Repeat this step with Tube B to break the foil seal before use. Be sure to wash and dry your hands before you begin using ZELSUVMI. ZELSUVMI is prepared and applied in just 3 simple steps. First, remove the cap from Tube A. Then squeeze the gel from Tube A onto the blue lane labeled Tube A on the dosing guide, making sure to cover the entire area of the lane and firmly replace the cap. Next, remove the cap from Tube B and squeeze the gel from Tube B onto the yellow lane labeled Tube B on the dosing guide, again making sure to cover the entire area. Each lane should be completely covered with gel from its corresponding tube. Firmly replace the cap. With your fingertip, mix the gels on the dosing guide using a circular motion to activate ZELSUVMI. Continue mixing for about 20 seconds to be sure that they are mixed well. Once the gels are mixed, you should apply right away. Using your fingertip, apply a thin, even layer to each bump. Be sure to treat each bump and avoid applying to skin where there are no bumps. If you run out of mixed gel before you have treated all the bumps, wipe off your dosing guide with a dry tissue. Then just follow steps 1, 2, and 3 and apply the mixed gel to the remaining untreated bumps. Remember to wait 10 minutes after applying the gel before putting clothes on to allow the gel to dry. And wait at least 1 hour after applying before swimming, washing, bathing, or showering. When you are done applying ZELSUVMI, clean the dosing guide with water and mild soap to remove any remaining gel, then dry thoroughly. Place the 2 tubes and the dosing guide back in the box and store at room temperature in a dry location. And always wash your hands when you are finished, unless hands were treated. During treatment with ZELSUVMI, it's important to remember the following information. Do not treat bumps close to the eye or get the gel in the eye. If the gel gets in your eye, rinse with water. Do not eat the gel. If the gel is swallowed, contact your healthcare provider. Do not apply the gel to open wounds. If the gel gets into an open wound, rinse with water. Do not get the gel in your mouth, vagina, or on areas of your skin where you do not have bumps. Keep ZELSUVMI out of the reach of children. Do not mix the gels until you are ready to apply ZELSUVMI. Do not throw away the dosing guide. Simply wash it after each use and allow to dry. Throw away any unused ZELSUVMI after 60 days. ZELSUVMI application can be easily incorporated into most daily routines during the treatment period. Applying ZELSUVMI at the same time each day, like during a daily routine, can help you stay consistent with treatment. Remember, it will dry in about 10 minutes, and there is no need to cover the bumps while using it. Talk to your healthcare provider if you have any questions about what to expect from treatment. What is ZELSUVMI? ZELSUVMI is a prescription medicine used on a skin, topical, to treat molluscum contagiosum in adults and children 1 year of age and older. It is not known if ZELSUVMI is safe and effective in children under 1 year of age. Important safety information. What warnings should I know about ZELSUVMI? ZELSUVMI is for use on the skin, for topical use only. Do not use ZELSUVMI near or in your eyes, mouth, or vagina. ZELSUVMI may cause serious side effects, including application site reactions. Application site reactions, including allergic skin reactions, are common where ZELSUVMI is applied to your skin, but can also be severe. Stop using ZELSUVMI and tell your healthcare provider right away if you develop pain, burning, stinging, itching, swelling, or redness of your skin that lasts for more than 24 hours after treatment with ZELSUVMI. Before using ZELSUVMI, tell your healthcare provider about all your medical conditions, including if you have other skin problems, are pregnant, or plan to become pregnant. It is not known if ZELSUVMI will harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if ZELSUVMI passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby during treatment with ZELSUVMI. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Keep ZELSUVMI and all medicines out of the reach of children. What are the possible side effects of ZELSUVMI? The most common side effects are application site reactions, including pain, burning, stinging, redness, itching, peeling or flaking, itchy, dry skin rash, swelling, breakdown of the outer layer of the skin, erosion, lightening or darkening of the skin, blisters, irritation, and infection. These are not all of the possible side effects of ZELSUVMI. You are encouraged to report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. Please see full prescribing information, patient information, and instructions for use for ZELSUVMI.